This is the lecture on related services. My name is Dr. George Giuliani from Hofstra University, and this is part 3 of the lecture. And we had just finished up discussing medical services, and now we're going to talk about school health services. Now, school health services are different from medical services. Again, remember, medical services deal with evaluation and diagnosis. But school health services, are different. These are going to be supportive services that enable a child with a disability to remain at school during the day and provide meaningful access to education. Now, in the Supreme Court, the U.S. Supreme Court case Cedar Rapids versus Garrett F., the U.S. Supreme Court held that continuing nursing services for a student were considered a related services and that school districts had to provide them under IDEA. So the Supreme Court said that continuing nursing services must be provided to students who need them under special education law as a related services. Because nursing services are not medical services, this is not for evaluation and diagnosis, rather nursing services were seen as supportive services. These are the services that would enable a child with a disability to remain at school during the day and provide meaningful access to education. Now let's talk about that. School health services are provided by a qualified school nurse or some other qualified person. And school health services are designed to enable a child with a disability to receive a free, appropriate public education. Look, the bottom line is that there are many children with disabilities who need nursing services or supportive services during the school day to receive a FAPE. And school health services include providing and managing specialized physical health care services, which are necessary during the school day to enable the child with a disability to attend school. Now, states and local school districts often have very specific guidelines that address school health services. So what are we talking about with school health services? What kind of children might need school health types of services? Well, think of children who might need special feedings. We just take it for granted that we can, eat our breakfast and our lunch and our dinner, and we have no difficulties with swallowing. But some children have very serious difficulties with swallowing, and they need special feedings. Some children need catheterization and other bathroom-related needs. There are some children who can't go to the bathroom without special help by someone. Some children have a lot of difficulty with saliva or getting things caught in their throat, and they need suctioning of saliva, suctioning of fluids in order for them to breathe and in order for them to eat. Many children will need medications throughout the day. Some children who have to be on their backs for a good portion of the day, such severe disabilities that they have to change positions so that they don't get sores or to prevent any kind of pressure sores, need to be moved. They need to be changed. If you think of a child in a wheelchair, that child can't be sitting all day in the same position. There needs to be movement within that child. And there needs to be care that is given throughout the school and school functions to prevent injury. So many children with disabilities will often need very specialized nursing care throughout the day. And the U.S. Supreme Court said that this type of care is a related service and is required by a school district to be provided to a student with special needs when it is appropriate. Now, school districts cannot require parents to attend schools with their children to perform health-related services. You can't say, well, your child has a lot of needs. Your child has a lot of different needs that's going to require full-day care. You as the parent need to take care of this, and you need to take care of your child. Because to say something like that would violate the IDEA mandate of a free, appropriate public education. Because it's not free to the parents if they have to commit their time. So school health services, although it can be very costly to a school, again, cost cannot be a factor here in determining appropriateness. So if the child needs it and it is appropriate, it is the responsibility of the school district to make sure that continuous nursing services is provided, and that is a school health service, which is a related service under IDEA. Another related service under IDEA is parent counseling. And parent counseling is exactly what it sounds like. Parent counseling and training as a related service means assisting parents in understanding the special needs of their children. It provides parents with information about child development and helps them acquire skills that will assist them to support the individualized program of their children. Now, think about what this really means. Suppose you're a parent of a child and you find out at age 4 that your child has autism. And you don't know the first thing about autism. You don't know how to raise a child with autism. You don't know what the needs of a child with autism are. You don't know what to expect of a child with autism. It's very important that you get the counseling that you need, that you get the education that you need in order to be a better parent. And so it's the responsibility of the school district to provide parent counseling and training when necessary to help parents teach about the child's development and help the parents get the skills that they'll need so that when we're developing an IEP for this child, the parent is on board and the parent understands this particular child. So many parents, when they find out their children have disabilities, they're like a fish out of water. They don't know anything about this, and they need help too in order to raise their child. And parent counseling provides the parent with the education that they need and helps give them the skills that they need to better support that particular child so that the IEP of the child can be fully developed with everybody involved. The last related service we're going to discuss in this lecture is travel training. And travel training is providing instruction to students with significant cognitive disabilities, as well as others, who need to develop an awareness of the environment in which they live and learn the skills necessary to move safely from school, home, work, and community. It is most often designed to prepare a student for post-school activities. So travel training is providing instruction to students with significant cognitive disabilities or other types of disabilities to teach them how to get around the environment. You know, for example, suppose you're a 17-year-old student and you'll be graduating next year, and you're going to go to work, all right? And you have to take the bus to get to work. Well, for all of us, taking the bus might be very simple. You get on the bus, you pay what you have to pay, and you go downtown and you get to where you need to get to. But learning how to ride a bus requires a lot of things. It means understanding the bus schedule. It means knowing where to get on the bus. It means knowing how to have the exact change for the bus. It means knowing how to get off the bus at the right stop. And it means a whole lot of other things in terms of getting to where you need to be. And this is not just common sense. This requires learning how to get from place to place. And so we often have travel training for students who are moving on from school to post-school activities after they graduate from school. So travel training refers to a program that provides instruction in travel skills to individuals with any disability except for visual impairments. Again, with visual impairments, we talked about orientation and mobility services. So a child with a visual impairment will get orientation and mobility services, but all other children receive what we call travel training. But it's the same idea in terms of learning how to orient yourself to the environment. So individuals with visual impairments receive orientation and mobility services. Anyone else learning these travel skills receive what we call travel training. And there are specific people known as travel trainers who do this. And they have the task of understanding how different disabilities affect a person's ability to travel independently and devise strategies to teach the travel skills to address specific needs. Because, for example, travel training for an individual in a wheelchair will be very different, say, than travel training for an individual with, say, an IQ of 50 with an intellectual disability. Both of those people may need help learning how to orient themselves to the environment, but the strategies that they need will be different. And that ends the lecture on related services.